All right, good afternoon, everyone. Thank you for joining us. We are here to actually present our parent university. The topic will be strategies to help your child cope with anxiety. And to start off our presentation, we have Miss Alicia Parker, who is our summit counseling counselor that is with us here at Advocate.
Thank you. As you said, so my name is Alicia Parker. I'm a licensed professional counselor here in the state of Georgia. I work with Summit Counseling Center, and I come to Avondale Elementary on Mondays and Tuesdays to see some of the kids individually for therapy. So today we're gonna talk about how to help your child with anxiety. So this presentation is called From Worry to Wellness, Helping Your Child Overcome Anxiety. This is just my contact information here in case you want to give me a call or shoot me an email after this presentation with any questions or concerns. So it's aparker@summitcounseling.org. And then my phone number is 678-893-5352. Okay, so I wanted to start this presentation with a quick deep breathing exercise. I know with anxiety, especially when it's your child, you might experience your own anxiety because you want to help them, and then maybe you're experiencing some anxiety of your own. So we'll start with a deep breathing exercise called box breathing. And so basically what that is where you imagine a box and you start from the bottom left corner of that box and you trace each side, doing part of each deep breath for each side. So as you go up, you will inhale for 4 seconds. Then you'll hold your breath going along the top, and then exhale going down and hold your breath again. And each side is 4 seconds long. So we want to make sure we're doing slow, deep breath as we're doing this. So if you feel comfortable, I would invite you all to find a comfortable position. You can put your feet flat on the floor, hands in your lap. You can close your eyes if you feel comfortable, or find a fixed point around the room. And I will guide us along for 3 deep breaths together. So inhale 1, 2, 3, 4. Hold 1, 2, 3, 4. Out 1, 2, 3, 4. Hold 1, 2, 3, 4. Again 1, 2, 3, 4. Hold 1, 2, 3, 4. Out 1, 2, 3, 4. Hold 1, 2, 3, 4. Inhale 1, 2, 3, 4. Hold 1, 2, 3, 4. Exhale 1, 2, 3, 4. Hold 1, 2, 3, 4. So that's just to kind of get us started with our topic of the day, which is anxiety. So first we'll define anxiety. So anxiety is defined as feelings of worry, nervousness, or unease. These feelings are typically about an imminent event or something with an uncertain outcome. So this is typically something that's in the future where you're thinking about worst case possible scenario and you start to worry or feel anxious. A lot of times people might think of anxiety as a bad feeling, but really it's not always. Anxiety can be good. It can be helpful to plan certain events, plan things that might be coming up to help you feel safer, more secure in that situation. These feelings can occur anywhere to anyone, and when temporary, they should not be a concern. Okay. So recognizing signs of anxiety in children. A lot of times you'll notice that they'll have physical symptoms as well as behaviors that you might pick up on that might tell you that your child might be feeling anxious. So some of those physical symptoms could include like tummy aches. They might start to feel restless, or you might see them fidgeting with things around them or shaking their legs or something like that. They might tense up their muscles or tell you that their heart is beating really fast. They're breathing rapidly, sweating or trembling. And then some behaviors you might also see are like times when your child is coming to you and they're constantly seeking reassurance. So they might want to come to you to feel safe or know that they are okay and secure. They might avoid whatever it is that they are anxious about. So they might try to run away from it altogether. Um, some children with anxiety dislike trying new things altogether. They like to stick to their routine, and anything outside of that routine seems very scary to them. So that's something that you might notice in a child experiencing anxiety. Someone with social anxiety might avoid eye contact. You might notice your child is clinging onto you a little bit more than normal. You could also tell that they are probably feeling a little anxious if there's something they're worried about and they can't get it off their mind. So it's something that they're talking about constantly. You notice they're in their head about it. So it's something that's constantly there until it's resolved. And you might also experience some trouble sleeping with this too. So a little, I think that we're going to do is kind of differentiate between what is temporary or expected anxiety in children, and then the opposite end of the spectrum where they might have like a severe anxiety disorder that might need additional treatment. So these are some of the anxiety disorders that we typically see in a therapy office. So there's generalized anxiety disorder, separation anxiety disorder, social anxiety disorder, specific phobias, panic disorder, OCD, selective mutism, which is where a child might be able to talk freely and communicate just fine in one situation, but then they'll go to another room or space and become completely mute. So that's selective mutism. And then PTSD is where someone might experience some really traumatic event that might lead to flashbacks or panic attacks or something like that. Okay. So I have a table here to kind of break it down for us. So on the left-hand side, we'll see different examples of some anxiety that you probably expect from a child. And it's temporary, it's normal, and probably age appropriate. And then on the other side of this table, we have the anxiety disorder version of that. So what it would look like if you should, go seek treatment. So the first one, we have worrying about a test or an assignment, but then they're able to calm themselves down afterwards. Generalized anxiety disorder would be an excessive worry that lasts most days for 6 months or more. Then we have the first day of school jitters. So I think it's pretty expected, right, for people to come to school on the first day after being home for the past few months to come in and be feeling a little nervous or anxious. So that is temporary. That's, expected. But then there's social anxiety disorder where a student might avoid coming to school altogether because of the fear of embarrassment or being judged by other people. We have being scared of the dark, but it's managed with reassurance. And then we have specific phobias where you might have an irrational, intense fear that leads to avoidance behavior, and it disrupts their daily activities. I think that's a really important piece there. So it keeps them from going about their day-to-day lives, and it makes it really, really hard for them to do the things they normally would. Separation anxiety when saying goodbye to parents at school that fades after the child adjusts. So if you notice that, or your teacher is telling you that your child is fine once they get back into the school, then that's probably temporary, something that they'll probably kind of grow out of. But if you're noticing there is an extreme distress when separated from a caregiver beyond the age appropriate level, then it might mean that they could have some sort of separation anxiety. So they might refuse to go to school, they might become clingy, or even have physical symptoms in their way, like the stomach aches and things that we just talked about. The last one here is feeling nervous before a recital or a sporting event, but still able to participate, right? Like that's expected. I think anyone would feel nervous going into a game or a performance. Where we would be concerned is when they start to have like recurrent panic attacks prior to that event. So where the child is experiencing a sudden episode of intense fear with physical symptoms like the rapid heartbeat, shortness of breath, or dizziness. Okay. And so next I wanted to sort of dive into two specific types of anxiety you probably see a lot more with elementary age kids and kids in school altogether. So there's anxiety around schoolwork and then anxiety around being around their peers, so social anxiety. So first we'll talk about anxiety around schoolwork. This typically comes from a fear of failure or disappointing others. So if there's a lot of pressure in the home to get straight A's, then a child might feel a little anxious about getting those straight A's. Or if they feel, and naturally, I do want to say, a lot of elementary age kids naturally just want to please their parents. And so they are used to getting a lot of praise for getting good grades, and then they suddenly don't, then they might develop some sort of anxiety around schoolwork. Perfectionism, unrealistic expectations, a lack of preparation or feeling overwhelmed by the material could lead to that school anxiety, and then previous negative test experiences as well. So a way to avoid anxiety around schoolwork is to help your child learn how to study. So creating a study plan, breaking down that material into chunks so that they're better able to remember it when it's time to take a test or time to put that material to use. We also, especially around milestone time, I know we preach getting enough sleep and eating well is really important, practicing that self-care so that they're able to focus during that test. Teaching relaxation strategies. So if there's some that you learn or find out from your own therapist that you think might be helpful for your child, it would be really helpful to teach them those strategies so that they are able to use those when they need them. And then lastly, I have one here, promoting a balanced perspective. And basically what I mean by that is a lot of elementary age kids have what we call black and white thinking. So it's like, it's either they're doing amazing, everything is great, or they failed and it's horrible. It's the worst thing that could have ever happened to them. And so we want to get them to learn how to find the gray area, right? So we want to help them understand like it's okay to make mistakes. Really trying to use that growth mindset when it comes to talking to your kids about your schoolwork, their schoolwork. And then supporting your child. So if you come to the realization that your child does have school anxiety or test anxiety, you want to normalize that anxiety for them. Let them know that they're not alone. This is completely valid and you understand. So that way they don't feel like ashamed, like something's wrong with them. Focus on the preparation and then again, creating that positive mindset for them. Okay, so next is social anxiety. So understanding social anxiety. Social anxiety can show up a number of different ways. We see a lot of avoidance of social situations altogether usually. So if a child knows that their friend is having a birthday party and they're only close with that friend, they don't want to be around other people that are going to be there. They might not show up if they feel that social anxiety. So that's an example of what that looks like. They worry about being judged or embarrassed, and it could lead to school refusal. So this is something that we really want to make sure that we're on top of and helping kids to understand that not all social situations could end up, bad. It stems from a fear of rejection, low self-esteem, and past negative social experiences. So this could mean like if there is a child that, for example, has been bullied at school and they just haven't had the best social life at school. They might not want to come back to school. They might fear being around other kids now, thinking that they might judge them or treat them poorly because of what they experienced in the past. Ways to avoid social anxiety is by role playing. I do this a lot, especially in therapy with kids that have anxiety. They'll come to me and they'll tell me what their worst case scenario is. And then when they do that, I'm like, okay, well, let's practice. Let's see how you would handle this if it were to happen. And so we'll talk about like how to initiate a conversation, how to initiate play at reset, those sorts of things. And that kind of builds their confidence so that when they're in the actual situation, they kind of know how to handle it. Another way is modeling social behavior. So there's a lot of research that kids are sponges, and so they kind of like learn based off of what they see. And so if they see you in a grocery store and you go and talk to the clerk, and you're confident, you're able to have that back and forth dialogue with them, then they'll feel a little bit more confident. They'll kind of know how that's supposed to look. And then the last one is teaching coping skills. Supporting your child, again, validating their feelings, challenge any negative thoughts that they're having. So an example I have of this one is I had a student tell me one time that they thought people were saying she was weird or crazy or something was wrong with them. And I was like, so you can read minds? Like, that's crazy. I don't know anybody that can read minds. And they kind of sit back and they're like, well, yeah, I don't really know what they're thinking about me. So challenge those negative thoughts and it kind of gives them a different perspective. Focus on effort. So again, going back to the growth mindset, if you see your child trying or attempting to have conversations with other kids or putting themselves out there to initiate play or conversation, you want to really focus on that effort because that praise really does encourage them to try again. Okay, so I have a few more tips here about what you could do. I like to use the analogy, put on your own oxygen mask. So if you are experiencing anxiety yourself, there's a high probability that your child senses that and they might feel that anxiety for themselves as well. So you really want to make sure that you're taking care of yourself, doing what you need to do and sort of modeling how to solve problems and how to model positive thinking. You want to, I know this is going to be hard because this is hard for me, but avoid rescuing your child from experiencing their anxiety. So this basically means like, I mean, and I get it. I have been there where like my child might experience some anxiety or discomfort and I just want to fix everything for them. But research says that actually doesn't help. So it actually keeps your child from being able to name their anxiety, to deal with that anxiety when it inevitably shows up again. And so because our brains do a thing that's called neuroplasticity. And what that basically is that when you're faced with a situation that makes you feel nervous or scared, you have two options. You can either avoid it or you can persevere and get through it. But if you avoid it, your brain is sort of relearning that this is scary, this is bad, I need to stay away. But if you persevere and get through it, then your brain rewires itself almost and kind of says, it tells your brain like, okay, this is safe, I can do this, and helps with that anxiety. So you kind of have to let your child experience that anxiety to learn how to deal with it. Communicate that they can handle their worries. Kids thrive when they feel like they know, they feel like they're safe. Help them name the anxiety to build emotional vocabulary and let them know that they're safe. And then develop a routine around calming strategies. So whether that's doing meditations or yoga every night before bed, those are things that can really help a child be able to better hold on to those coping skills and be able to use them when they actually need them. I have on here some apps that you could download that are really helpful. Headspace and Calm are two of my go-tos. And then a few books that I have as well that I use with kids are called Ruby Finds a Worry, Wilma Jean the Worry Machine, and Worry Says What. So hopefully this was helpful in determining what is temporary anxiety and what might be a little bit more of a disordered type of anxiety. If you feel like what you're working on with your child isn't working, or if you feel stuck, I would really encourage you to talk to your child's teacher or your school counselor, Ms. Johnson, to discuss the need for a referral for individual therapy. Some of the types of therapies that or treatment modalities that therapists use are called play therapy, cognitive behavioral therapy, and dialectical behavior therapy. All really effective. And that is it. Thank you so much for coming to attend this presentation. I enjoyed being here. And yeah, thank you.
All right, thank you, Ms. Alicia, for that wonderful bit of information. At this moment in time, we want to open it up to any questions that parents may have, so that Alicia can address your questions or concerns. If you want
They
me
might-
Okay. And yes, if you, if you can unmute yourself and you can just speak right into either your phone or your device that you're watching this presentation on, and we can answer your question in real time. All right. Well, again, Alicia, thank you for that information. And now we're just gonna switch gears just a little bit, and we mentioned talking about self-care. So I'm going to change it now to Miss Kristen, who is here to just give us some tips on some self-care, some mindful wellness, not only for our students, but for our parents as well. Miss Kristen, please.
Hi, everybody. Thank you for joining us today. My name is Kristen Feldstein. I am a yoga instructor at Fusion Academy, which is a private high school over in Alpharetta. And thankfully I was invited to do this today. I also am a parent of two teenagers that went through the Johns Creek school system. So we're very familiar with Fulton County. I currently have a senior in high school and a
Is it just me or we can't hear?
Today, I'm going to talk about trying to reduce that stress for not only our children, but also for parents and how we can cope with the things that are stressful. Obviously we can't always fix everything that's causing the stress and anxiety, but hopefully this will give us a minute to kind of step back away from it all. So as Alicia showed us and demonstrated before, we're going to start with some box breathing. So it kind of just brings our stress levels down a little bit, focusing on our breathing, kind of getting us into a nice steady breath, centering ourselves to get prepared to do a little bit of yoga. So we're going to kind of focus on yoga and meditation today, and both pulled together. This not only will help our children as we teach it to them, however, but it will help us in order to better help our own children. So what we're going to do is we're going to get in a comfortable position. If you want to sit with your feet flat on the floor, and we're going to put our hands on our knees, and we're going to just drop our chin down to our chest. And we are going to start, we're going to do the same thing that Alicia taught us before. We're going to breathe up for a count of 4, across for a count of 4. We're going to hold that breath as we go down we're going to exhale that breath. And then as we go back across, we're going to hold that breath in. So we're going to start with a deep breath in. 1, 2, 3, 4. Hold that breath. 1, 2, 3, 4. Exhale. 1, 2, 3, 4. Hold. 1, 2, 3, 4. Inhale. 1, 2, 3, 4. Hold. 1, 2, 3, 4. Exhale. 1, 2, 3, 4. Hold. 1, 2, 3, 4. One more time. Inhale. 1, 2, 3, 4. Hold. 1, 2, 3, 4. Exhale. 1, 2, 3, 4. Hold. 1, 2, 3, 4. We're going to bring our chins back up. And what we're going to do is we're going to work on trying to release some of the tension we may carry in our shoulders, our neck, typically where we hold our stress. So a lot of times we start to feel a little bit of tense and tightness. So these are a couple things that we can do just to kind of start to ease those muscles. I recommend that if you really are feeling a lot of stress, take a longer, more of a restorative type yoga class, which is really holding those muscles and getting really deep into that muscle tissue, and it really releases those fibers. And there's great demonstrations that you can Google and find online. So, but due to our time constraints today, I'm going to start with just warming up. We're going to roll our shoulders up and down, up and down, up towards our ears and down, up and down, down, and up and down. Now we're going to roll them forward. So we're going to bring up, bring forward, up, forward, up, forward, up, forward, up, forward, up, forward, up, forward, forward, up, forward. One more time, up and forward. We're going to work on our neck muscles now. So what we're going to do is we're going to bring our chin down to our chest again. And we're going to slowly inhale and roll our ear towards our shoulder on our right side. Slowly going towards the back, but not letting our heads drop. We're going to take another deep inhale in. As we exhale, we're going to bring our chin back down towards our chest. Exhale all the way out. We're going to inhale and do the same thing on our left side. Bringing our ear towards our shoulder. Bring it back. A deep inhale through our nose. And exhale, bringing it back down. Bring our chin to our chest. And inhale in through our nose. And exhale through our mouth. And we repeat what we just did over to our right side. If you feel a spot that's starting to feel a little bit more tense, pause at that spot and just roll back and forth. Taking some nice deep inhales in and exhaling out. Picturing nice cleansing breath as we inhale. As we exhale, we're exhaling all that tension out. back to our chest. And go back to our left side. Inhale. Chin back down towards our chest. We're gonna repeat this 5 more times on each side. And go to the right. Chin back down. Inhale, arm to the left. Go back down. Deep inhale to the right. Inhale. Exhale. To the right. Inhale. To the left. And last time to the right. And to the left. So we're going to stretch out our shoulders a little bit. So I'm going to take our right hand, pointing our thumb down towards the ground, crossing over our left hand to the top, interlacing our fingers. We're going to inhale, bringing our hands in. And we're going to bring our hands through and get a little bit of a stretch this way. We're going to hold this, inhaling in through our nose, exhaling out from mouth. A deep inhale through our nose, out of our mouth. One more inhale. And as we exhale on this one, we're going to bring our hands back through, bringing our hands up towards the ceiling. We're going to arch our back just a little bit in the chair and look up towards the ceiling. Continuing to breathe. Nice, calm, steady breath. Take a nice deep inhale through our nose. And as we exhale, we bring our arms out and around. We bring our hands to our chest. We're going to do the same thing on our left side. Left hand out. Cross over our right hand, interlacing our fingers. We're going to take another deep inhale through our nose. And bring our arms through. Holding our hands out in front of us. Hopefully feeling a little bit of a stretch. And focus on our breathing again. Nice deep inhale through our nose. Exhale. Inhale. Exhale. One more inhale. As we exhale, we're going to bring our hands back through. Bringing them up towards the ceiling. Inhale again. Exhaling. Inhale. And exhale. More inhale. So we exhale and bring our arms around. Back towards our chest. And now what we're going to do is we're going to put our hands on our knees. And we're going to keep our feet flat on the ground. We're going to take a nice deep inhale and we'll bring our arms up. Holding this. Take another inhale. And as we exhale, we're going to go down towards the center. Reaching down as far as it can go. Just kind of letting your body dangle. Remember to keep breathing, nice steady breath. Inhales through your nose. Exhale through your mouth. Or inhale. Exhale, we'll come back up, bring our arms up, reaching over our head. Inhale. Inhale. Inhale through your nose. As we exhale, we'll go back down towards the ground. Or deep inhale. And come back up to center. We're going to work on a little bit of a meditation, just to kind of wrap everything up. So we put our hands on our knees. We're going to bow our chin towards our chest. You close your eyes. As we're sitting here, just keeping focus on our breath. Make sure we're breathing in through our nose, up through our mouth. Inhale in through our nose, through our mouth. As we continue that breathing, I want you to picture yourself in a field full of flowers. You're sitting underneath the shade of a tree, and next to you is a nice creek that's just going along nice and smoothly. You can hear the babbling from where you're sitting. The sun is shining. As it breaks through the shade, and it's not even feel on your skin. Comforting. Nice little breeze. I want you to think about taking out a piece of paper and a pencil and making a short list of the things that are bothering you. These small little things, but they could be bigger worries, things that just kind of keep coming back into your mind. Make a list of those things right now. Remembering that you're in the moment, that you're surrounded by all things of nature that are comforting. When you're done making that list, I want you to take it up in your hand. I want you to crumble it. Crumble it into a ball. I want you to throw it into the stream. The stream's going to take it away. And the paper's going to disintegrate. So you didn't just litter. And we're going to carry away those things that are bothering you. I want to focus on this moment. Feeling comforted, relaxed. Hopefully your muscles are stretched out a little bit. And you feel a sense of calm. Try to carry that with you throughout the rest of the day. We're going to slowly bring our head back up, opening our eyes. And hopefully we can take that calm and not worry about the things on the list for the day. Another thing that I usually will recommend to everybody is journaling. Keeping a gratitude journal so that way you get into the habit, routine, even in the morning when you wake up, before you go to bed, just jotting down a few things that make you feel good, things that happen that day that you're grateful for in your life. And maybe there's some days that you have a lot of things to be grateful for. Some days maybe nothing seems to be grateful, or nothing seems to be grateful that's happening in your life. However, it could be as simple as walking outside and hearing a bird chirping and just, it's kind of a sense of, okay, things are good in the world. You can take that journal and you can go back a month from now and look back and see this was going on in my life, and there was a lot of stress and anxiety happening. But I was able to find a few things each day that made me feel good. So it helps us bring our focus into the things that are good in our life as well. And I think that's good to bring with our children to kind of keep us calm and focus on the things that we're grateful for. Hopefully, everybody feels a little bit better.
Thank you so very much. Thank you. All right, thank you for that positive self-care strategies. I believe that is all that we have for today. Again, parents, thank you so very much for participating. We will be uploading this video on our website. So if you or anyone that you know needs to revisit this video and just kind of catch up on some strategies, we'll have that posted for you and we'll make sure that we provide that link in our Hilltop admins. All right, again, Ms. Kristen, Ms. Alicia, thank you so very much.
Thank you.